So dramatically accelerating the post-surgical recovery in that recovery of digestive function following the surgery. Then there is a nausea and vomiting. So nausea can prevent you from getting out the bed and you need to move around to regain normal bodily functions. And vomiting can irritate the muscles and stitching around wound. The following remedies may be taken every 2 hours during intense symptoms and every 4 hours during less intense discomfort. So if improvement is not obvious after 24 hours, consider the another remedy. Then phosphorus 30C, it helps to prevent or treat nausea after surgery, especially when the patient has a strong thirst for ice drink and may also have a concurrent headache. So phosphorus is useful when there is a ice drink thirst with the concurrent headache in the nausea after surgery. Then Epicac. Epicac 30C is effective for persistent nausea with the vomiting and when vomiting does not provide relief. Arsenic album 30C treat violent and incessant vomiting which is made worse by eating or drinking cold water and there may also be burning pain in the stomach. So arsenic used when there is a burning pain in the stomach and aggravation by eating or drinking cold water. An ipecac is used when there is a persistent nausea with the vomiting. Constipation. Surgical procedure, especially the abdominal gynecological operation, typically slow or stop the normal bowel function. So the following remedies may provide relief from the constipation. Take one of these remedies 3 times a day for up to the 4 days. If there is no improvement after 24 hours, stop taking it. Arnica 30 help with constipation due to the experiencing shock characterized by a pale skin tone. China 30 is useful for large accumulation of fecal matter that is difficult to expel and especially if the patient is experiencing small amount of diarrhea instead. Raphanus is indicated when there is a constipation with no urging for the stool and or when there is painful gas in the upper left part of the abdomen. Then phase out flatulence. Surgery can disrupt your digestive system, resulting in flatulence. The gas may collect and cause jabbing pain and severe bloating. So carbo-veg assists the people who suffer from great distension and offensive gas. This remedy is best if you get relief from release and if carbonated drink ease the gas pain. Symptom officinalis is useful when there is a more pain than distension. So frequent rumbling in the abdomen and no relief from releasing gas. Colosins work when there is a more pain than distension and cramps are relieved by bending over. Raphanous sativus help people who have a distended abdomen but are unable to expel gas. Recommended dosages are take one of the above in 6x or 6c or 30x or 30c potency every 2 hours during intense pain and every 4 hours during mild discomfort. If you doesn't improve after 24 hours, then try another remedy. Where is the other student? Hmm? They only give presenting in the first session. They no need of the lecture, na? I have talked to principal about this. Then swelling, stiffness, pain, bruise, and the soreness. For this, Leadum Pal 30C may help to relieve bruising and swelling around the eye after surgery. So it is also useful for pain and swelling after the surgery on varicose veins. Rustock 30 it is useful when stiffness, soreness, and restlessness after any surgery. So it is often recommended after operation on tonsils and adenoids, appendicectomy, and the dental surgery. So for the swelling, stiffness, pain, bruise, soreness after the surgery, Lidum pal, Rustock, Arnica, calendula, Staphysagra are useful. Arnica 30C or 200C is useful when there is a pain following the surgery with cough. And if not nearly universal experiences, the homeopathic remedy arnica is traditionally used as a treatment for trauma and therefore has been proposed for reducing surgical pain, soreness, and bruise. So, calendula 3C, 6C, 12C, 30C promote the formation of granulation tissue. Staphysagra 30C to 100C pain following surgery. Mode of infection. Surgical infection from bacteria like Staphylococcus aureus affects 50,000 American Union annually. And according to the Center of the Disease Control and Prevention in Atlanta, infection which can strike an immune system. So compromised by surgery may cause complications like bleeding, prolong your recursion, protect yourself against the infection with the ferrophos. So, in a mode of infection, that is, in a many infections, we can use homeopathic medicine. Recommended doses are 2 days prior to the surgery, begin taking 6 or 60 of ferrum 4 times a day every 6 hours and stop taking it the day of your surgery. Then gynecological surgery, in that for the abortion and miscarriage, Ignatia 30C every 4 hours. In cesarean section or episiotomy, Staphysagra 30C or belly spur 30C every 4 hours is used. Then in dilatation and curettage, that is in DNC, belladonna 30C every 4 hourly. In hysterectomy, causticum 30C every 4 hourly is useful. In orthopedic surgery, Ruta 30C is the first remedy for the surgery involving cartilage, tendons, ligaments, and periosteum. So it is therefore a great remedy in the surgeries involving the knee and the other joints. So scarring is a thiocinamide, that is 6X. In that scarring, thiocinamide 6X is used once in a day for 1 week and repeat 1 month later if necessary. So this is a repertory in that we can see the surgery that is complement from anesthesia problem from bleeding, cancer, colic, fistula, gallbladder surgery after removal, then healthy granulation for the hernia, inflammation, intestines are the many points that remedy or homeopathic remedies are given in the cases of surgery. In the cuts, for dissenting cuts, gangrenous condition, inside wound, inflammation, swelling, then in the bone, broken or fracture, then the breast injuries, These are the various points. Then, in case of the lacerations of eye, knee injury, kidney stone, joint injury, gland injury, genitalia injury, gasping for air, gallstone, gallbladder pain, bones broken or fractured, blunt instrument from bones bare or crushed and splinters. These are the various rubrics given for the surgery and orthopedic, that is brittle bone fracture of a callus favor production children's in compound fracture, then inflammation after fracture of the tibia, periosteum injuries, pricking pain, sleeplessness from slow healing or of broken bone, then splinter bone protruding, union of fracture to promote breast injuries, mastectomy after, then in case of the cut, dissecting cut, gangrenous condition, inside wound, inflammation, sharp instrument from glass, suppuration with thick yellow matter, swelling, surgery complication from adhesion after anesthesia problem, from bleeding after cancer for colic in lithotomy or ovariotomy, fistula operation of after gallbladder surgery after removal, healthy granulation to promote and to prevent or arrest gangrene, hernia for pain in abdomen and after inflammation from, then intestine paralysis after laparotomy. So these are the many rubrics which are present in the homeopathic repertory for the cases of the surgery and orthopedics. So this is about the role of the homeopathy in surgery. So in the next lecture we will start our lecture with the regional traumatology, that is orthopedic lecture. So till that we stop here and have a good day. And where is the other student? They don't require a lecture. So why? What is the problem? If any problem, talk with me. Or you have some problem, then talk with principal sir. Why they don't attend a lecture? Hmm? Jagruti, Sonal, Vijay. Where is the other student? Hmm?
माहिती मॅम.
काय माहिती? Present.
मॅम ते नेटवर्क इश्यू असेल त्यांचं.
हा विजय, जे माझं
हो
लेक्चर
मॅम.
लास्ट मिनिट पर्यंत अटेंड करणार आहे तेवढ्यांचीच प्रेझेंट मिळणार. फक्त जागृती, विजय आणि सोनल यांचीच प्रेझेंट आज लागणार आहे. बाकीच्यांची नावं नाही पाठवायची मला. कोण पाठवतं मला अटेंडन्स? हा, हाफ लेक्चर अटेंड करता आणि तुम्ही त्यांचा अटेंडन्स पाठवता मला. जे स्टुडंट फुल लेक्चर अटेंड करतील त्यांचाच अटेंडन्स मी घेणार आहे आणि तोच प्रिन्सिपल सरांना पाठवणार आहे डेली. हाफ लेक्चर अटेंड करणाऱ्यांचा अटेंडन्स घेणार नाही. कळवा तुमच्या मित्रांना, मैत्रिणींना.